Okay, so we've got two hearts here, which I've got basically from Waitrose. It's ideal if you get your hearts for dissection direct from the slaughterhouse, because when you buy them packaged up ready for food, you find that the meat inspectors in the abattoirs have actually cut open some of the hearts in order to inspect them to make sure that there's nothing wrong with them, no disease and so forth. Anyway, we have to make do with what we've got, so I've picked out two of the better ones, and I'm going to start off by just looking at the outside of the heart. When we look at the top of the heart, basically we can see some of the blood vessels. We can see blood vessels here, two of them. These are part of the pulmonary trunk. So these are actually carrying blood up to the lungs. And you can see there's a branch going to the right lung and a branch going to the left lung there. These are arteries, so they're quite flexible. These are taking the maximum pressure that's obtained from the heart in the pulmonary circuit. The blood from the lungs returns back to the heart on this side, and this one's slightly out of shape, so it's a little bit difficult to make out what's coming where, but essentially this is the returning blood just here, entering first of all into the left atrium and then going down through the one-way valve into the right atrium. Just behind the pulmonary trunk we've got the aorta. So here's the aorta, quite thick walled as you can see, and you might be able to see the thick walls of the aorta and the pulmonary artery just there. And the pulmonary, the aorta, if you just follow it down, it's going down, straight down to about here. And that, of course, is where the left ventricle is. You always find when you buy hearts that are intended for human consumption, virtually all of the right atrium has been sliced away. And so you won't see much of the entry vessels on that side, you won't see much of the vena cava and so on. But you just have to make do with that, and we just work with what we're given. When you're looking at a heart from the front, what you want to do is to get it so that this groove, which is called the sulcus, the coronary sulcus, is running diagonally more or less from the top left to the bottom right, and using right and left in terms of the heart. The person whose heart it is. The material just here, that's part of the left atrium. It helps to enable the left atrium to enlarge. You always find there's a lot of fatty tissue around the top of hearts, and we'll look at this one as well. And so on this one here, you can see quite a lot of fatty tissue. There's nothing wrong with that at all. That's perfectly normal, and it's just supplying a ready-made source of energy, I guess, for the heart. What you don't want, of course, is for it to build up too much. Now I'm going to start by making a cut, and I'm going to expose part of the heart here. It's not necessary to wear gloves if you're handling a heart of this type, and I always find personally it makes it difficult to actually feel what you're working on. One thing you find is that if you feel the sulcus, it feels much more solid than the material either side, and it's almost as though that is hollow, and of course it is, because that's where the atria and the ventricles of each side are. The sulcus coincides with the wall of the heart that separates the right and left of the heart, that we call the septum. The septum is the wall of the heart in the middle. So anyway, here goes. We're going to try and make sure we've got this as right as possible. Quite difficult when they come straight out of the shop like this, so we're going to take our scalpel in, obviously watching for our fingers. So here we are, we've just opened up this side, and I've deliberately tried not to cut these structures. These are the tendinaceous cords, which we've talked about in class. So these are anchoring this structure, which, believe it or not, is the valve. That's what separates the top and bottom of the heart. It looks dreadfully fragile, doesn't it? Just here, you've got papillary muscle. So this is holding on to the tendon, which is anchored to the material of the valve, and it will tense and it will prevent the whole thing turning inside out. Just here you can see that you've got the septum. I'm going to dissect this heart through, and then I'm going to dissect the second one that I've got, just so that we've got two. You can't always be sure that you're cutting in exactly the right plane. So there we are. So that's number one. Here comes number two. So there's the left atrium again. There's the sulcus, a little bit more correctly positioned on this one. You can also see the blood vessels on the top, just there, and you can see the remnants of one just there. That is the remnants of the vena cava. Right, so let's try cutting down this side as well. So we'll try and get it in position again, bring it round, and up the other side, like so. There we go, and again we've got a nice exposure there of those valves. You can see there very nice visualization of the valve. This is dividing the top and bottom of the heart. This rather large chamber here, this of course is the left ventricle, absolutely huge compared to the right ventricle. Notice as well the thickness of the walls, quite thin on this side, only pumping up to the lungs. On this side, much thicker, because it's pumping round the body. And if we follow this passage up here, we'll find that we pop out of the top. Let's try it on this one. So we'll just open up this heart a little bit more. Sorry, tendinaceous cords, you've got to go. So we'll just cut the septum here. I was a little bit low down on this one, but again you can see how large the left ventricle is compared to the right ventricle, but I'm just skewed round slightly on that cut. Not to worry. There's the valve, and if we just reach in, there we are, popping up through the aorta. So that little finger there, my little pinky, has popped out of the left ventricle, and it's just coming up through the aorta just there. On the other side you can see there's a passageway here that's going to go up through the pulmonary trunk. So what you've got here is a slightly off-center view of the right ventricle. Let's switch back to this one, where we're a bit more on the right plane for examining the difference. Try and get it the right way up before we get too far. So there's our right ventricle, there's our valve just there, and we should be able to find a way up through here. There it is. Just cut straight through the middle of it, so that's taken us up through the pulmonary trunk. So there's the inside of them. Very impressive view of these valves here. Let's just pull on those tendons. And if we pull on those tendons, so strong, it's absolutely amazing. And that valve, which looks as though there's nothing at all to it, really strong stuff there. Finally, I'm going to look at the front of the heart. I'm going to cut across the sulcus. And what I'm actually doing is I'm actually finding a way in to the internal blood supply of the heart, the coronary blood vessels. And if I just probe around a little bit, maybe there would be a little bit better. We should be able to find a blood vessel. I can just see him. There he is, just there. Okay. That shows you that is the size of a coronary blood vessel, a coronary artery. Let's have a go on this one here. So there's our front of the heart. Obviously the coronary blood vessels are all through the muscle of the heart. Here we go again. And we're just going to see if we can find that coronary blood vessel, and there it is, straight in, like so. That's amazing to think. There are literally thousands of those, of course, spreading through the heart muscle, supplying it with oxygen. And there's the other one. You can actually see, if you look at it just there, you can see the way in. It's very close to the surface here, actually running through the sulcus, but there are lots of other coronary blood vessels a bit lower down. You might have just been able to see one just there, if I just open it up. We've just sort of cut through one. That's quite a big one. But there are lots and lots of other ones, very, very small. And of course we're talking about capillaries as well, so we're talking about things which are about 7 micrometers in diameter. So that's our heart dissection, just a very quick look through what you expect to find if you dissected a heart. I hope you found it enjoyable, and I'm sure my dogs will find these equally enjoyable when I give them to them when I get home.